on comprehensive study of prevalence, risk factors, and treatment outcomes of ROP in a tertiary hospital. A lot of ROP work going on.
A very warm good evening, respected delegates, and a small yet intellectual audience here. Indeed, it's kind of a continuation to Dr. Parmar. I'm going to speak on retinopathy of prematurity in a tertiary healthcare center in UP. I do not have any conflicts of interest or any financial relationships to disclose. And why are we discussing ROP? Because it's a leading cause of visual impairment and blindness among prematures worldwide. As she stated, 36 to 48% of the incidences right now stated in India. The most important risk factors are early gestational age and low birth weight, and currently countries like India and other developing nations are facing a third epidemic of ROP. The aim of my study was to estimate the prevalence, identify the risk factors, and assess the outcomes of the management that we had performed in our center. It was a retrospective cohort analysis with a duration of 3 years, the study location being NICU of a tertiary healthcare center, and the screening was performed as per the Rashtriya Bal Swasthya Karyakram guidelines. In fact, there's a new Muskan scheme also running by the government. Cases were classified according to the international classification of ROP3 classification, and the fundus photographs were acquired on RedCam Trinetra Neophorus. We had a total of 371 infants screened during that time, out of which 103 had ROP. On the left-hand side, you can see concentric rings around the fundus diagram. That is how zones of the ROP are divided. And on the right-hand side, there's a pie chart which shows the distribution of the stages in my screened group. Most of the patients had stage 2, that is a demarcation ridge, and followed by stage 1, that is line. I have skipped up most of my results because of paucity of time. Anyhow, the most important ones were that the risk factors which we assessed were classified into 2, maternal and neonatal. Upon neonatal risk factor assessment, oxygen supplementation was found out to be the most statistically significant, and 88% of the ROP, 88% of the infants who had ROP had supplementation in any form, either prongs or ventilatory support. The distribution of birth weight, as you see on the bar graph, most of the major chunk of the patients had less than 1500 grams. 65% of individuals belong to the less than 1500 gram group. Now, our study found a positive correlation with low APGAR score. APGAR is an acronym that stands for appearance, pulse, grimace that is seen on the face of the child, appearance, and respiration, which is usually performed at the NICU setting by either paramedical staff or neonatologists. So the APGAR score, which was calculated at 1 minute, had, I'm so sorry, there's some, I guess, sir, please do not move. Yeah, thank you so much. Yeah, the mean APGAR score that we found at 1 minute was 3.96 plus minus 0.52. The standard deviation was such. And a normal APGAR score, as we all remember from our PEDS class, was 7 to 10. But the ROP kids had a very low APGAR score at 1 minute. The intervention were taken as per the ET, ROP, and BEAT study. We performed laser barrage in 17 eyes and instilled intravitreal bevacizumab in 2 patients, 2 eyes. 1 patient denied giving any consent. There was an iatrogenic posterior capsule touch in one of the patients, so we had to perform lensectomy with posterior capsulotomy and antivitrectomy for the complicated cataract that we gifted, and it was performed by a visiting surgeon. Stage 4 and 5 ROP were referred to a higher center, and rest of the patients were followed up accordingly with the IC-ROP classification. I need to point out that in the era of anti-VEGF injections, it is not entirely necessary to just jump upon and go ahead with the anti-VEGF injections. There are few cases where I have seen zone 2 stage 1 ROP with popcorn vessels and stage 2 ROP with popcorn vessels. They had spontaneous regression by 38-39 weeks because most of the ROP doctors dealing with ROP jump upon with anti-VEGF injections. There's one case with stage 3 plus disease, and it had a notch as well over here. So it was stage 3 entering zone 2 anterior. We had performed laser barrage. Again, we could eliminate the use of anti-VEGF. We deal with a very low economical status population. So we need to carry on our decisions wisely. In this case, only laser barrage was done again at 35 weeks, and post-laser, you can see the fundus photographs here. It is doing, the patient is doing great. So prematurity in itself is the biggest risk factor we know, and there are many studies carrying on across the world. saying that there are many risk factors, but hyperoxia is one thing that our country does not really point it out because the fluctuations of oxygen is the main culprit here. We right away flush the patient with oxygen and remove the oxygen support as well, and this is what happens in tertiary healthcare in UP, I would say. And that hyperoxia stage during the early postnatal period can start a cascade of vascular and tissue events. So we need to be careful when we are doing this. Apgar score is one criteria that can be used by paramedics and doctors in peds and ophthalmology department, which can be used as a marker for prognosticating ROP. We do not need anti-VEGF in all cases. Zone 2 and 3 with stages less than 3 do not require intervention as seen in this study. And laser barrage and anti-VEGF injection, both modalities were studied in this group. But I do not have any long-term sequelae right now in this study because I'm working on a paper. We have myopia and few patients with macular drag also seen. Yet I would probably present it another time. Thank you so much.
So, I am a little bit inquisitive. As per preterm babies are concerned, normally what type of Apgar score do they have?
Ma'am, both 1 minute and 5 minutes.
Yeah, so in preterm babies, what is the mean Apgar score that these babies have with or without ROP? What I'm trying to ask is this.
The literature says the patients would come with 5 or 6.
I am not interested about the literature. You have done the study, so you must have seen other preterm baby Apgar scores. So what was their score? What was their mean Apgar score?
Same range, 5 to 6, ma'am.
So, but
the ROP had, yes, ma'am, we did not run any statistical data on it. And we have a proper register. It's not uploaded on any software. We just have a manual data register where we put up all the...
Right. You have come to this conclusion that Apgar score is an important risk factor.
Important parameter that can help us that the patient might have a severe ROP in further cases.
That's a risk factor, isn't it?
Yes, yes.
So how did you come to that conclusion?
We had a ROC curve, receiver operating curve, ma'am, against the same data. We plotted it against it, and then it was found that it basically is 1 minus sensitivity versus the specificity. The graph is run on it, and there's a perpendicular line which is drawn. The ROC curve is given by MedCalc software, ma'am, or SPSS
ROC
software.
curve, yes, I know what
so
is
the
ROC
sensitivity
curve,
was 78%, so it pointed out that it is a very nice criterion that we can use. So we started the same thing. The neonatologist and the nurses now inform us beforehand that the Apgar score is so and so, and that is how we go ahead, ma'am.
Okay, but I think it would have been interesting had you noted down the Apgar
That's
score
one lacuna,
of the other
preterm
babies and compared the two, then probably it would have.
So that is to
it
say,
would have a greater weightage of this
right. So
analysis.
that is to say, if you are talking about a risk factor, you have to have a measure of risk.
Okay. I mean,
and correlation is not a measure of risk, right?
Yeah, you have to find out the proportion between the low Apgar score and incidence of prematurity or something like that.
Sir, I'm really sorry.
I mean, if the Apgar score is low, incidence of prematurity is more.
Yes. The severity is more.
That
yes, sir.
That you want to establish.
Yes, sir.
So you have not done a positive relationship.
It's more like a tunnel vision only in ROP kids. I should have included.
Picked up, exactly.
Yes.
You've just picked up the ROP
One
kids
section.
and disregarded the kids who did not have ROP.
But
should have studied them also. Then a comparative one would have been.
It's a retrospective study. I do have the data. Yeah, thank you so much.
So Dr. Ritu has a lot of